So welcome all viewers. Welcome to the Sipher Health News. So we have today with us Dr. Preethi John, and we will have an informal interview with her. So this is going to be released. The informal talk is going to be released on the World Suicide Prevention Day, which is 10th of September 2022. An estimated 7 lakh people a year take their life around the world. For every suicide, there are about 20 other people making a suicide attempt, and many more have serious thoughts of suicide. So millions of people, they suffer intense grief or are otherwise profoundly impacted by the suicidal behaviors. Such suicidal death is a public health concern with a profound impact on those around them. By raising awareness, reducing the stigma around the suicide, and encouraging well-informed action, we can reduce instances of suicide around the world. The 10th of September each year, it focuses attention on the issue, reduces the stigma, and raises awareness amongst the organizations, the government, and the public, giving a singular message that suicide can be prevented. Creating hope through action is the triennial theme for the World Suicide Prevention Day from 2021 to 23. So this theme is a reminder that there is an alternative to suicide, and it aims to inspire confidence and light in all of us. So you're welcome, Dr. Preethi John. And I'm Dr. Rakesh Gupta, President, Sipher, and former Director, LSS Punjab. And my co-host is Professor Dr. Sonu Goyal. He's from School of Public Health, Department of Community Medicine, and School of PGI Chandigarh. We welcome you all for this special edition of Sipher Health News channel. As I told you, it is going to be to coincide with the World Suicide Prevention Day on 10th of September 22. And we feel really honored to have with us an eminent public health expert, Dr. Preethi John, for an informal talk. So Dr. Sonu, I think you can introduce her.
So thank you, Dr. Rakesh. So it's my privilege to introduce Professor Preethi John, who has done her PhD and also an Harvard Lead Fellow. She is a Deputy Director, MBA Health, Chair Board of Examiners, UCL Global Business School of Health for Health. She is also a visiting scientist and Harvard Lead Fellow, Harvard T.H. School of Public Health. She is a co-founder of Women in Global Health India. She was director of Chitkara Global Health Institute, Chitkara University, and also hold position of Professor and Dean, School of Health Sciences, Chitkara University. She has been a senior faculty and head training division in one of the topmost eye care institutes, this is Aravind Eye Care System. She had also worked as a research officer in Government Medical College, Surat, Gujarat, and Institute of Health Management, Pachod.
So thank you, Dr. Preethi. So I think we can go ahead with it is going to be a very informal kind of talk. And we just want to motivate young public health people that they should be inspired by people like you who have done well in the field. So you are considered as one of the senior most public health management experts. So what do you think are the immediate tasks in hand for India to reduce the NCD burden?
Thank you very much, first of all, for this invitation. It's a very important topic, which is the theme for today. Before going into that, to address your question related to NCD, I think India has come a long way. And if you look at from a very clinical point of view, what needs to be done, the set of interventions, the clinical interventions that are in place, it's very clear what is the pathway a patient needs to follow. The challenge is, even though broadly the clinical pathways are clear, people are still not getting identified at the early stages when the onset of disease. So the whole screening or the prevention is where we need to focus on. as people progress and go through probably the more advanced, we think about, whether it's surgical interventions or rehabilitative interventions. But I think as public health professionals, if we could focus on the fact that recognizing that clinical interventions are in place, what is it that we in public health could do to ensure that this know-how, the clinical know-how which is there, the talent, the devices, the diagnostics, the medicines, the cure, which is available within the hospital facilities at different levels, how can we ensure it reaches the community at much earlier stages? So one part is immediately is, what is it we can do to improve awareness? What is it we can do to improve capacity building? And it is not just of one cadre of workforce. We are talking about, it could be skilling up further the frontline health workers. It could be those at the primary healthcare level. The focus is right now moved to not just primary healthcare, but also well-being. And all of this constitutes the need to address NCDs. The other, I feel, as a challenge is in order to really address NCDs, we have to take the multi-sectoral approach, and that's been promoted by the Government of India. The challenge is at the ground level, how do you make it happen? Because both a multi-sectoral approach as well as recognizing that it is a range of healthcare professionals which need to work together to kind of address this issue. How do we really promote a very healthy multidisciplinary teamwork? So in short, I would say we probably have the best of clinical know-how as well as the infrastructure. We probably have the best of policies. But then the onus is on the public health professionals. How do we connect the policies, connect the clinical know-how with the gaps that are there, which is more related to the whole management. So public health management, how can we improve so that no patient really needs to go to a level 2 or a level 3, but at very early stages with good screening, community-based screening, telehealth-based screening, we can identify and provide interventions which are far more cost-effective, which could take place within the community or within the family caregivers with their help. It could get addressed. And of course, it continues with appropriate, for example, at certain levels, they would need to come in for maybe more diagnostics, more checkup, more screening. But that filtration process should easily be set in place. And I think we have a huge challenge. So this is a challenge for all of us in public health management. And I am sure those who are getting in will figure out more innovative ways to address this challenge. Thank you.
So I agree, Dr. Preethi. Actually, this is a big challenge because more than 60% of deaths, they are because of the non-communicable diseases. And there are some, like smoking and alcohol, which can be easily, preventable causes are there. And as you correctly said that we need to screen at a proper time. So prevention is the best thing that we can do. And I may just tell you that Sipher has got an MOU with Healthy India Alliance. So we have taken all the major stakeholders on board and we have formed a working group. So we are addressing the issues like we are now allowing people living with NCDs to be part of the planning and management process. So thanks a lot. So Dr. Sonu.
Thank you, Dr. Preethi, for a very nice response to the first question. Recently, you had been selected as one of the fellow of prestigious fellowship, that is Harvard Lead Fellowship. And can you tell to our audience about your experience in that fellowship. How was you selected? What was the criteria of being selected? What is the advantage for a public health professional or a public health manager who want to pursue his or her career in leadership? Advantage, how this Harvard Lead Fellowship is advantageous to him or her?
Thank you. I think a fellowship offers a time when you have been working for several years or decades, a time of reflection. You take a sabbatical and you rethink what are the areas that you have developed, what are the areas you have currently skill, expertise, and what is it you can focus further so that you can contribute in a better manner. So the Harvard Lead Fellowship, which is jointly offered by the Harvard Global Health Institute, as well as the Women and Health Initiative at the Harvard T.H. Chan School of Public Health, it really offers, I would say, a transformational fellowship. The whole idea being to promote leadership skills in individuals from low middle income countries so that future women leaders can be mentored in global health. There is enough research which shows that women are agents of change when they work in leadership position. And this kind of a quote is what led to this particular fellowship getting created, as research shows that women can implement policies that create better lives for families, communities, and even nations. So the eligibility or the selection process is they ask for about almost 15 to 20 years of work experience as one of the criteria, along with putting together a plan of what you will do with the opportunity that you are getting. So there is a process wherein you apply, answer a lot of questions, write up a lot of essays as part of the application process. And then comes, once you're shortlisted, there is an interview process which further probes into the kind of thought that you have on how you are going to be utilizing this fellowship. Unlike, when we study our master's degree or other degrees which have a very prescribed curriculum, here the idea is that depending on what you would like to do, you tailor a curriculum which will best help you to achieve that outcome. So we are provided, as a Harvard Lead Fellow, we are provided access to Harvard faculty. Now, the Harvard faculty could come from any school. It's not limited to the School of Public Health. It could be from Harvard Business School, the Harvard Kennedy School, literally across the campus. And that's, I thought, one of the most amazing privileges that we had, to be able to do coursework in different schools of Harvard, to have access to different faculty. We are also given mentors. I was privileged to have several mentors, including Dr. Vikram Patel, who really, I think, opened up several opportunities for me. The other is we also got to deliver seminars, not just to our own cohort, but to the wider Harvard community. We are given a lot of networking opportunities, speaking opportunities. We're able to take forward a project work. As a co-founder of Women in Global Health India, I do have a plan about how can I take mentorship for women in India forward. And last year, I also got recognized as a global health mentor. This is in a global forum. So I think this opportunity of the fellowship, and I also had a leadership coach which kind of worked with me on my future plan and how I can better utilize this opportunity so that in turn, I can kind of, through a ripple effect, touch the lives or mentor several other public health professionals to go forward with their plans or perhaps take up leadership opportunities. So I think this kind of allows us to kind of recalibrate and really explore things we might not have explored otherwise as we are busy in our day-to-day life. So this was a tremendous and definitely a very life-changing opportunity personally for me. And it has just concluded, but I think it's probably the start of what are the different ways I am going to give back. And that's, what is going forward right now. Thank you.
Yeah, thank you, Dr. Preethi. I think, first of all, congratulations for being selected through a very rigorous process. And as I know about this fellowship, only very few people, I think handful of people are being selected on the yearly basis, and they get a chance to interact with the prestigious Harvard faculty doing some projects, I think with them. So I think opening a totally new horizon. And as you rightly pointed out, that it's a type of reflection, whatever you have done. So it's time to think and rethink that how we can dwell upon them a little more. So I think that's a wonderful opportunity. And thank you for telling our audience about the process. And I hope that the youngsters and the people who are in the middle of their careers are listening to it. Yes. And they will find it useful to apply for who want to become a leader in global health. So they would like to apply for it, and maybe they
Yes.
will also get an opportunity.
Dr. Sonu, if I could just add on, I think an important point you had mentioned is it's a mid-career fellowship because the whole idea is to focus on leadership. So while there are several early career fellowships, the importance is now seen to look at mid-career fellowships, and particularly for women to rethink whether it is possible or how is it possible for them to take up leadership positions, because very often we see that career continuity, they kind of stagnate because of different reasons. So how do you kind of break out of that and take up the opportunity? So like you said, this is offered for 4 individuals every year. In our particular cohort, we were lucky, 5 of us were selected, but I was the only person selected from Southeast Asia. So it is definitely a great opportunity.
Yeah, thank you, Dr. Preethi. Over to Dr. Rakesh now.
So I think you have, done capacity building of many public health specialists, the youngsters. And we have been also calling you, Dr. Sonu has been calling you for different events. And I'll just like our viewers to know that what has been your role in capacity building of the young public health specialists?
I think this is in 2 ways. One is the very straightforward, where you offer different programs to build public health management capacity in people who have completed their undergraduate degree by offering them a master's degree, which they can consolidate in this particular area. Our focus has also been to ensure that this opportunity is provided to a wide array of healthcare professionals. It could be people from MBBS, Ayush, it could be nursing, it could be allied health workforce, it could even be those who are aspiring to make a change in healthcare, so they come from engineering or other backgrounds. So that's the very straightforward path in terms of a master's education or following it further with a PhD. The other is also to kind of expand the horizon, that what is the role of management in the healthcare system? So if all these students are graduating, they are of course looking for careers. So when people are looking for career, it is not only a single career. For example, they get a job as a manager, but they are seeking a career path. So wherein they join into a particular position, but over the years, they would like to advance. Now, this requires the recognition within the healthcare system of the importance of management. While people think, oh, management need not be learned, I know how to manage. Anything that we spend time to learn the scientific aspects of it, we will also be able to use tools and techniques whereby we are more efficient or more effective in doing that work well. So even though management is both an art and a science, that's the most quoted, because it does require common sense as well, besides the use of whatever you are learning. So this part of my role, I think, is to probably influence or convince different people that it is important to learn public health management, whether it is through the executive education mechanism, whether it is through a short-term course, whether you're attending something as a certificate course, or you're able to do it as an online kind of a course. But it is important to learn this in a structured, systematic way, and then apply it back to your workplace. So the final point I would like to again leave here is, I think particularly in India, we've been very innovative and very good at developing our clinical staff. Our clinicians are recognized as the best in the world, and that is why you see them all over the world, because of the good quality clinical training they have in India. But what is missing, we really need to scale up the management training. And I feel, right now it's more in the purview of the master's degree and higher. I feel it needs to be given importance even into undergraduate degree of every single healthcare professional. So they are more sensitized to what is the need for better management. And if that takes place, I really feel our health system will improve in a much more accelerated pace, besides looking at other things like infrastructure, financial resources, or HRH. But I think management capacity strengthening is equally important. So in these dimensions is certainly where I hope to have done work over the last couple of decades to really influence that.
And ma'am, I think I can agree with you, because being a clinician till the age of 50 years, so I actually never knew about management. I learned a lot from Dr. Sonu Goyal, who is a management expert. So I agree that everyone should be able to manage, and the public health people, they really know how to manage, because they know theoretically also. So how to manage different programs, the health programs, and the day-to-day activities and office setup. And clinicians, they may not be able to do that good in the management part. So thank you. And Dr. Sonu, I think you can just go ahead with the other part.
Thank you, Dr. Rakesh. And we are actually there is a World Suicide Day, Suicide Prevention Day on 10th. So because public health professionals play a very important role in prevention and control of suicide, which are increasing day by day. So what is your perspective, Dr. Preethi, about the roles of public health professionals in prevention of suicide, and what is your message on this day?
I would like to just start out by saying long back, while in Kerala, Kerala is known for its extremely good health statistics on one side. But at the same time, it was also leading for suicide among youth. And one of the research I had undertaken was attempted suicide among youth. The timing was immediately after the 10th standard exam, and I was in the medical college to carry out this particular study, and it was quite disheartening to see the results that announced, and then over the next week to a month, there would be several cases coming in. Attempted suicide refers to people who tried but failed in their attempt. So speaking to these students, their family members, gave me an insight into what is the actual kind of ground reality. And then working on different aspects of it, like, for example, could there be like a hotline or a phone line to which they can call to? And today in India, several of that is established where people can reach out to help. And in fact, there's a little story from Google as well, wherein apparently, people Google for everything, right? So people would Google how to commit suicide. And the people at Google picked this up and realized that's like a very big wrong use of Google. So today, if that is done, it goes actually to the police, or there is a referral to it. So what is it that we in public health can do? I think, when we talk about, like, if we were just to talk about NCDs and we say diabetes or cancer, there's not that much stigma around it. But when you talk about suicide, there is so much of secrecy, stigma, shame attached with it. Not only the person has died of suicide, but for the people who are left, the friends, the family members, it can take a very severe toll on mental health. So what is it public health professionals can do to create hope and prevent suicide? One, I just think we need to start talking about it a lot more. We need to facilitate a lot of open discussion on mental health, be it at home, be it in school, in the workplace. It's very, very important to share stories about how suicides can be prevented. And this would require a very large investment in capacity building. Healthcare providers, it could be of family members, it could be people in the workplace, because every time if a suicide has occurred and you talk to people would start sharing, yes, that person had completely stopped talking, they were giving away their favorite things, and you see this again and again. So if people knew about it, they could alert it and not feel so terrible, after which you can do nothing about. So I think awareness, capacity building, open discussions, these are very important. At the same time, we need to encourage people who are affected by suicide to share stories or seek professional help, and that it's okay to seek professional help. So giving awareness of where is it they can contact, this should be highly publicized. So I think these are some of the actions to create hope and prevent suicide. And as a final message, what I would say is, if each one of us could take a pledge that our life is so important, and that all of us, we are created unique to make a difference in this world, and that we are not worthless. So we need to be self-empowered to address self-harm and also suicide through preventive action. So So this day is a day for each of us, not only to reflect about ourselves, but to reach out to others in our vicinity and also share this message on World Suicide Prevention Day. Thank you.
Thank you, Dr. Preethi. I think very well said. I think sharing of stories is a very good idea about prevention of suicides. And also, I think if a person understands that he or she is of worth, and everybody in this world who has come has some qualities, and everybody differs from each other. We don't compare between us, and everybody has to give something to the society. If they understand this, I think the suicide thing will go away. So very nicely said, Dr. Preethi. Over to Dr. Rakesh.
So thank you, Dr. Preethi. I think you have given a very precise message for the people who are depressed. And nowadays, actually, very young students, even 10, 12 class students, and young professionals, because of the stress in the workplace. So they are, stressed out. So I think we must give them a very precise message to all that life is very precious and they should not attempt suicide and they should seek a professional advice. So thanks a lot, Dr. Preethi. So I'm sure that public health, young public health professionals will learn a lot from you, and all our viewers will definitely be motivated to follow people like you who have been in public health for some time. And I appreciate that you have been able to spare time for us. Thank you.
Thank you, Dr. Preethi.
Thank you very much.
Thank you.